Good morning, I'm Dr. McKenzie. Today I'm going to talk about what is brain rehabilitation. So brain rehabilitation is where we figure out what part of the brain or parts of the brain are not working appropriately, and then we figure out how to change those functions. We can do a combination of therapies between neurofeedback, which is something that we do and the Mayo Clinic also does, and we can also do home exercises where we can figure out very specifically what activates and makes your brain fire at the correct frequencies so that your brain has its maximum function and you have the best outcome. So the question would be to me, what kind of people should consider this kind of therapy? And there's a whole host of people that should consider this therapy. People with learning disorders, any kind of child that has issues in school with learning. We also should consider anybody that has memory issues or mood disorders, such as anxiety and depression. Also, people that have had strokes or traumatic brain injuries, or people with migraine headaches. There's a whole bunch of different possibilities, including sleep disorders, addictions, and you can see concussions and brain injuries. There's a whole bunch of things listed here. But also, when we do this, we should also be looking at your labs, because if we want to maximize brain function, we have to make sure there's no anemias, we have to make sure there's no blood sugar issues, and there's a whole bunch of other things that we have to look at. Also, people can have neuroinflammation where the brain is actually inflamed, and so we have to figure out how to turn off this inflammation, and we can measure and quantify this. And so basically, this is what we do is we start with a central nervous system vital sign, where we interact with a big TV screen, and we can quantify depression, anxiety, and all the different kinds of memory. So we test them and we look to see how well do you perform. And then we also put on a cap on your head. It looks like a beanie, but it's really an electro cap, where we do quantitative electroencephalogram, where we map out the brain itself. We look at the different kinds of brainwave activities, and we see how different circuits are working in the brain, and we figure out exactly what parts of the brain don't work. And so then from here, we can create strategies to change a person's outcome. Thank you.